Treatment options for thyroid cancer at the present stage. I want to emphasize right away that I always provide statistics from the USA in my publications, as I believe, in my personal opinion, that it expresses the greatest trustworthiness. According to the latest data from the American Cancer Society, about 44,000 new cases of thyroid cancer are expected in the USA this year, and more than 2,000 people will die from this disease. Thyroid cancer develops in the cells of the thyroid gland, which is shaped like a butterfly at the base of the neck. This gland produces hormones that regulate heart rate, blood pressure, body temperature, and weight. In the early stages of the disease, there may be no obvious symptoms. However, as thyroid cancer progresses, symptoms such as swelling in the neck, changes in voice, difficulty swallowing, and pain in the neck and throat may occur. There are several risk factors that can increase the likelihood of developing thyroid cancer. Women are more often affected by this disease than men, likely due to the levels of estrogen in their bodies. High levels of background radiation or radiation received at certain points in a patient's life can also increase the risk of thyroid cancer. Some genetic syndromes, such as familial medullary thyroid cancer and multiple endocrine neoplasia, may also be associated with the occurrence of this type of cancer. There are a variety of treatment methods for thyroid cancer, and the choice of a specific method depends on the type and stage of the cancer, the overall health of the patient, and their preferences. In some cases, particularly with small forms of papillary thyroid cancer, immediate treatment may not be necessary, and patients may be offered active surveillance with regular checkups. However, if treatment is needed, the most common methods include surgery, thyroid hormone replacement therapy, radioactive iodine, and alcohol ablation. Surgery is the most widely used method for treating thyroid cancer. It may involve the removal of part or all of the thyroid gland, as well as the removal of lymph nodes in the neck. Radioactive iodine is used to destroy residual thyroid cancer cells after surgery. Alcohol ablation involves the injection of alcohol into the cancerous areas of the thyroid with the aim of destroying them. Alcohol ablation is a procedure in which a special soluble substance is administered intravenously to destroy cancer cells. This can be an effective treatment method for small areas of thyroid cancer, especially if surgery is not possible due to the patient's poor health. However, alcohol ablation may not be sufficiently effective for controlling widespread or aggressive thyroid cancer. Additional treatment methods for widespread thyroid cancer may include targeted drug therapy, which targets specific molecular targets in cancer cells, radiation therapy, which uses high-energy beams to destroy cancer cells, chemotherapy, which uses drugs to kill cancer cells, radiofrequency ablation, where cancer cells are destroyed by high-frequency electrical impulses, and cryoablation, where cancer cells are frozen and destroyed. Palliative care is specialized medical care aimed at alleviating pain and other symptoms of serious illnesses, such as thyroid cancer. The goal of palliative care is to improve the quality of life for patients and their families. Palliative care specialists work together with the patient, their family, and the medical team to provide additional support and care. Thyroid hormone replacement therapy aims to replace or supplement the hormones that are normally produced by the thyroid gland. It is typically prescribed after the main treatment has been administered. Treatment for thyroid cancer can be effective, and most patients achieve a successful recovery. However, each case is unique, and treatment decisions should be made by the physician considering the individual circumstances of each patient. Regular examinations and consultations with an oncologist will help monitor the condition and choose the most appropriate treatment method.